Question 1. The exchange of gas in the lungs takes place by A. Bronchioles, B. Alveoli, C. Trachea, D. Bronchus. And answer is B. Alveoli. Question 2. The function of cerumen, wax, is A. Protect the ear, B. Help clean ear canal of foreign matter, C. Protect ear canal from water damage, D. All of these. And answer is D. All of these. Question 3. The causes of the high birth rate in India are all of the following except A. Early marriage, B. Traditional customs and habits, C. High level of literacy, D. Universality of marriage. And answer is C. High level of literacy. Question 4. A pictorial diagram of frequency distribution which consists of a series of blocks is called A. Line diagram, B. Pie chart, C. Histogram, D. Frequency polygon. And answer is A. Line diagram. Question 5. The part of the brain which controls body temperature is A. Thalamus, B. Hypothalamus, C. Pons, D. Medulla oblongata. And answer is A. Thalamus. Question 6. Glucocorticoids and mineralocorticoids are secreted by A. Pancreas, B. Gonads, C. Hypothalamus, D. Adrenal glands. And answer is D. Adrenal glands. Question 7. Substantia nigra secretes which of the following major neurotransmitters? A. Adrenaline, B. Dopamine, C. Serotonin, D. Noradrenaline. And answer is B. Dopamine. Question 8. The principal cells of the epidermis that produce keratin in a complex process are A. Melanosomes, B. Keratinocytes, C. Melanin, D. All of these. And answer is B. Keratinocytes. Question 9. The total number of bones found in the right upper limb is A. 25, B. 30, C. 40, D. 60. And answer is B. 30. Question 10. In the following which are both endocrine and exocrine glands? A. Pituitary, B. Thyroid, C. Pancreas, D. Adrenal. And answer is C. Pancreas. Question 11. The anatomical term for the breastbone is A. Sacrum. B. Sternum. C. Patella. D. Clavicle. And the answer is B. Sternum. Question 12. The aim of the National Strategic Plan is to eliminate tuberculosis by A. 2025, B. 2030, C. 2035, D. 2040. And the answer is A. 2025. Question 13. The lowest layer of the atmosphere is A. Stratosphere, B. Troposphere, C. Mesosphere, D. Ionosphere. And the answer is B. Troposphere. Question 14. Which is the largest nerve in the body? A. Sciatic, B. Peroneal, C. Pudendal, D. Tibial. And the answer is A. Sciatic. Question 15. The increase in urban population is due to all of the following factors except A. Employment opportunities, B. The attraction of better living conditions, C. Availability of social services, D. High mortality and morbidity. And the answer is D. High mortality and morbidity. Question 16. The literacy rate taking into account the total population in the denominator is termed as A. Effective literacy rate, B. Crude literacy rate, C. Life expectancy rate, D. None of these. And the answer is B. Crude literacy rate. Question 17. The number of new cases occurring in a defined population in a specified period of time is called A. Prevalence, B. Incidence, C. Secondary attack rate, D. Point prevalence rate. And the answer is B. Incidence. Question 18. An epidemic usually affects a large proportion of the population, occurring over a wide geographic area such as a continent or world is called A. Endemic, B. Sporadic, C. Pandemic, D. Exotic. And the answer is C. Pandemic. Question 19. The ratio of the incidence of the disease among the exposed and the incidence among the non-exposed is called A. Attributable risk, B. Relative risk, C. Population attributable risk, D. All of these. And the answer is B. Relative risk. Question 20. The time interval between invasion by an infectious agent and the appearance of the first sign and symptom of the disease is called A. Serial interval, B. Incubation period, C. Latent period, D. Communicable period. And the answer is B. Incubation period. Question 21. The main purpose of a vaccine vial monitor is to A. Ensure safe transport, B. Prevent damage to vaccine, C. Ensure heat-damaged vaccines are not administered, D. Easy administration. And the answer is C. Ensure heat-damaged vaccines are not administered. Question 22. The person, animal, object, or substance from which an infectious agent passes or is disseminated to the host is called A. Reservoir, B. Source, C. Carrier, D. Latent infection. And the answer is B. Source. Question 23. The changes that occur during the second trimester in the fetus are all of the following except A. Fetal heart sound can be heard with a stethoscope, B. Skeleton is calcified, C. Eyes remain closed and body growth accelerates, D. Lightening occurs. And the answer is D. Lightening occurs. Question 24. A woman's serum and urine will test positive for HCG in all of the following conditions except A. Pregnancy, B. Ectopic pregnancy, C. Vesicular mole, D. Post-hysterectomy. And the answer is D. Post-hysterectomy. Question 25. Transmission of maternal antibodies to the unborn child through the placenta is an example of A. Active immunity, B. Passive immunity, C. Humoral immunity, D. Herd immunity. And the answer is B. Passive immunity. Question 26. Failure of descent of one or both testes at birth in the newborn is called A. Phimosis, B. Hydrocele, C. Cryptorchidism, D. All of these. And the answer is C. Cryptorchidism. Question 27. Complications during pregnancy and childbirth can be prevented by A. Skilled care at birth, B. Early detection of risk, C. Appropriate and timely management of obstetric complications, D. All of these. And the answer is D. All of these. Question 28. White or yellowish-white secretions that last for 10 to 15 days after delivery is called A. Lochia rubra, B. Lochia serosa, C. Lochia alba. D. All of these. And our answer is C. Lochia alba. Question 29. The main components of essential newborn care are the following except A. Resuscitation of a newborn with hypoxia. B. Prevention of hypothermia. C. Prevention of infection. D. Prevention of behavioral problems. And our answer is D. Prevention of behavioral problems. Question 30. Recommended volume expander for a neonate in shock is A. 5 milliliters per kilogram of normal saline. B. 10 milliliters per kilogram of normal saline. C. 15 milliliters per kilogram of normal saline. D. 20 milliliters per kilogram of normal saline. And our answer is B. 10 milliliters per kilogram of normal saline. Question 31. The diagnostic techniques used to detect congenital anomalies in utero is A. Alpha-fetoprotein. B. Amniocentesis. C. Chorionic villi sampling. D. All of these. And our answer is D. All of these. Question 32. The minimum interval between two doses of TT vaccine given to antenatal mother should be A. 1 month. B. 2 months. C. 3 months. D. 4 months. And our answer is A. 1 month. Question 33. Babies who are at high risk of developing retinopathy of prematurity are A. Preterm neonates. B. Term neonates. C. Postterm neonates. D. All of these. And our answer is A. Preterm neonates. Question 34. Vitamin A supplement is given under the Reproductive and Child Health Program for children up to the age of A. 1 year. B. 3 year. C. 4 year. D. 5 year. And our answer is D. 5 year. Question 35. Measles, mumps, rubella vaccine has to be given A. After birth. B. After 3 months. C. After 6 months. D. After 9 months. And our answer is D. After 9 months. Question 36. At the healthcare facility, health workers can adequately protect vaccines by all the following measures except A. Keep vaccines in appropriate vaccine refrigeration equipment. B. Use of temperature monitoring device. C. Transport vaccines in a vaccine carrier. D. Store vaccines in the door of the refrigerator only. And our answer is D. Store vaccines in the door of the refrigerator only. Question 37. The route of administration of the Salk polio vaccine is A. Oral, B. Intramuscular, C. Intravenous, D. All of these. And the answer is B. Intramuscular. Question 38. The vaccine for yellow fever is A. Salk vaccine, B. 17D vaccine, C. CHO vaccine, D. PREP vaccine. And the answer is B. 17D vaccine. Question 39. The following vaccination is included in the National Immunization Program. A. Vitamin A, B. Vitamin B complex, C. Vitamin D, D. None of these. And the answer is A. Vitamin A. Question 40. The target groups of weekly iron folic acid supplementation, WIFS, are A. School-going adolescent girls and boys in 6th to 10th class, B. School-going adolescent girls and boys in 10th to 12th class, C. School-going adolescent girls and boys in 8th to 12th class, D. School-going adolescent girls and boys in 6th to 12th class. And the answer is D. School-going adolescent girls and boys in 6th to 12th class. Question 41. The components of adolescent health programs are all except A. Weekly iron and folic acid supplementation, B. Adolescent reproductive and sexual health program, C. Menstrual hygiene scheme, D. Vitamin A supplementation program. And the answer is D. Vitamin A supplementation program. Question 42. What is the first sign of puberty in females? A. Voice changes, B. Axillary hair, C. Breast development, D. Menarche. And the answer is C. Breast development. Question 43. The dosage of tab, albendazole administered to prevent Helminth's sensation in adolescents is A. 200 mg, B. 400 mg, C. 500 mg, D. 600 mg. And the answer is B. 400 mg. Question 44. The menstrual hygiene scheme, MHS, was implemented for adolescent girls in the age group of A. 10 to 22 years, B. 10 to 19 years, C. 16 to 19 years, D. 15 to 19 years. And the answer is B. 10 to 19 years. Question 45. bacteriologically confirmed or clinically diagnosed case of tuberculosis involving pleura, lymph nodes, abdomen, and genitourinary tract is called A. Pulmonary tuberculosis, B. Extrapulmonary tuberculosis, C. HIV positive tuberculosis, D. HIV negative tuberculosis. And the answer is B. Extrapulmonary tuberculosis. Question 46. All of the following infections are transmitted by fecal-oral route except A. Hepatitis A, B. Hepatitis B, C. Diarrhea, D. Poliomyelitis. And the answer is B. Hepatitis B. Question 47. The illness caused by a mosquito bite are all of the following except A. Lymphatic filariasis, B. Malaria, C. Dengue, D. SARS. And the answer is D. SARS. Question 48. Chikungunya virus is transmitted to people through A. Pigs, B. Mosquito bites, C. Chicken, D. Birds. And the answer is B. Mosquito bites. Question 49. A hepatitis D infection occurs only when the person is positive for A. Hepatitis A, B. Hepatitis B, C. Hepatitis C, D. Hepatitis E. And the answer is B. Hepatitis B. Question 50. The infectious disease caused by the variola virus is A. Chickenpox, B. Smallpox, C. Measles, D. Rubella. And the answer is B. Smallpox. इससे संबंधित अधिक जानकारी के लिए हमारे चैनल को सब्सक्राइब करें। धन्यवाद।